Hello and welcome to ThePrint. I am Sumi Sukanya Datta, and we have with us today Dr. Ambarish Mittal, Chairman and Head, Endocrinology and Diabetes with Max Healthcare. The US Endocrine Society earlier this month released the guidelines on the role of vitamin D for the prevention of disease in Boston. These guidelines have generated considerable interest as they propose some major changes from the current clinical practices. In this context, I'll request Dr. Mithal, first of all, welcome, sir. Thank you so much for joining us in the conversation today. I believe you were also in Boston for the release of the
Yes,
guidelines. Yes.
yes.
So, could you please share why the society needed to come up with these guidelines and what exactly do they entail?
See, vitamin D research is a very dynamic field. The last
Mm-hmm.
guidelines by the Endocrine Society were in 2011, and there they looked primarily at patients coming to clinic, like how should they be treated, what kind of levels should be achieved, and that kind of stuff. This guideline is a population guideline. This guideline
Okay.
actually talks of prevention of disease, so it doesn't talk of treatment anywhere. So vitamin D guidelines for prevention of disease. That's the thing. So that is one major difference. In these
Mhm.
12 or 13 years, lots of data has come out on the outcomes. So one is that you improve vitamin D levels, you improve calcium, but are you looking at actual outcomes like diabetes, like heart disease, like cancer, like mortality, and of course, at fractures and osteoporosis? So these guidelines are more based on outcome, on clinical outcomes. Does vitamin D impact clinical outcomes or not? That's the reason
Okay.
why. And these are more sort of general public guidelines rather than patient-based clinic guidelines.
Okay. Okay, sir. So, what are the key takeaways? Could you please, briefly tell us, guide us through what exactly do they say?
So I think the important parts that they say is first is that testing for D levels is grossly overutilized, and it really is not very useful because the correlation between testing and outcomes of disease has not been very strong. So if you're going to give someone, again, we're not talking of treatment, we're talking of just for a population. If there is no advantage in universal screening for vitamin D by testing levels, which is exactly what the Indian societies recommend, and which is also what others recommend. So there's nothing new, but they emphasize this a lot. Universal screening is not recommended. So people getting their D levels just for the heck of it, it doesn't really matter. Okay, doesn't really
Sometimes, for
help.
instance, people are feeling tired all the time, then also the doctors recommend. So, all that, do you think all that won't really be required?
No, if you're feeling tired, if you have any symptoms and the doctor feels it's required, it should be done. But if
Okay.
you're, testing D as part of these packages or others where we don't know what the patient has and then chasing the vitamin D level without any
Mm-hmm.
symptoms at all is probably what is now not recommended.
Okay.
A
So,
different
are
aspect
you?
of this, mention is that measurement of vitamin D is also a big problem. When I say that, I mean that the technology for measurement of vitamin D has improved a lot over the years. And unless and until people are following the best techniques to measure vitamin D levels, we make a lot of mistakes. So
Yeah.
therefore, that's another technical aspect. But yes, please go ahead.
Yeah. So, I needed to understand, for instance, I'm a healthy person, but I'm going for this annual package, health package that I take. Are you saying that, I don't really need to, unless I have any specific symptoms, I don't really need to take this vitamin D test, among other tests that my package
So
offers?
yes. So what these guidelines strongly suggest is that we don't take any test for normal healthy people. And I think that is because they've not been able to correlate the levels of vitamin D with general health. That is the issue. Now, however, they do say that some groups of people should take vitamin D supplements without testing. So on the one hand, they are
Okay.
saying don't test, and there's some they are saying just take vitamin D without testing. So the most important group in that is, for example, is children. So earlier on, only very young children were given vitamin D. Now they're saying up to the age of 18, children should be supplemented with low dose vitamin D on a daily
Mm-hmm.
basis. Now, this is really important. So, this is actually a big change because you're really saying that children in their growing age, when the bones are actually forming, then vitamin D is very important. And I'm glad they've said this because all studies done in Delhi, in India, have shown that our school children, at least half of them, are significantly deficient in vitamin D. So
Yeah.
if we need not test, because tests cost a lot, and I told you there's some question even about reliability. So using low dose vitamin D is completely harmless and
Mm-hmm.
will possibly benefit many of these children. For example, in Indian studies, 1,000 units a day was enough to correct D deficiency in our kids. So this is one big change that you're saying, okay, use it in kids without even testing, right?
Yeah.
So that's the group. The second group where they're saying that is in elderly, so extremes of age now, above 75. They are saying everyone should be given low dose vitamin D, or most people should be given low dose vitamin D. So I think it's important that these guidelines suggest that children up to the age of 18, 1 to 18, should be given low dose vitamin D throughout on a daily basis, actually. And although this was a recommendation earlier, also it was for very much younger children, only up to 2 years or up to 4 years, maybe, you know. But now they are saying right through adolescence. And I think that makes a lot of sense because we have also shown, my colleagues have shown, Dr. Marva has shown that in Delhi school children, the D deficiency is very common. And 50% of such children may be below, maybe severely deficient or significantly deficient. So
Mm-hmm.
therefore, this formula of not testing but giving all kids through the growing age low doses of vitamin D works well. In India, this dose is probably going to be around 1,000 units. I think in the West they recommend 600 to 800, but we are talking of 1,000 units here. That's a minor difference, but the fact is that they're recommending this without testing. So that is one group. The second group where they are recommending D supplementation without perhaps even testing, because again, I mentioned the fallacies of testing, is those above 75. Those above
Mm-hmm.
75, when if you give low dose vitamin D, you will find that you're reducing their overall mortality. There's data to show that overall mortality goes down. So again, you need to give maybe 1,000 to 2,000 units per day in that group. In the Indian setting, those above 75, they're also the group that is most prone to osteoporosis and fractures. So it makes a lot of sense. What they are saying is don't measure and try to titrate, just give them this small dose. You can't go wrong,
Yeah.
right?
So
So
one
this is
question
second.
we often face, yeah, one question we often face is that we are a country with abundant sunshine, for instance. Why do we need vitamin D supplementation, especially for our kids who spend considerable amount of time playing outside, for instance, where they get enough exposure to sun? But do these guidelines really apply in Indian context, given our geographical conditions as well?
Absolutely. In fact, India has some of the lowest D levels in the world. India and Middle East, which are actually also it's a very sunny area. Lebanon and other places around there, they have very low vitamin D. Why do we have low vitamin D? There are two reasons. Well, there are many, but two broad reasons. Number one, Indians don't like to go in the sun. So except for our manual workers, so you will find normal D levels in people who work on the street, people who work on construction sites, people who pull rickshaws, do those kind of things. You will find normal D levels. But in anybody else who stay indoors most of the day, particularly during heat, during summer, we are always indoors. We avoid the sun, like it's too hot, and we also Indians have this sun phobia of getting dark and skin burn and all that. So I think it's therefore D levels in Indians have consistently been shown to be low. Number one. Number two, about children, and the question is very relevant. They are playing in outside, but the atmospheric pollution that cities like Delhi have prevents the UV rays from reaching the skin. And therefore, this has
Okay.
been again shown very clearly, even in controlled exposure of children to sunlight, especially during winter, the D level doesn't go up. So I think it's important that we realize
That's because of the
that despite
pollution
all of
levels, large.
time, we are not getting enough D in our blood, and that's why our bone health is suffering. So this is
Yeah.
the other point. One other point is new in the guidelines is the fact that they've also advocated for pregnancy. So they've advocated supplementing D throughout, again, which is very relevant for India and very significant. It wasn't there in an earlier recommendation that for pregnancy also pregnant women should be supplemented with low dose vitamin D on a daily basis to improve outcomes. So again, that's really really significant. People are looking at, oh, vitamin D is over, but actually the recommendations say something else. It's the testing that they have trashed. They've said you
Okay.
don't really require testing. So that is the main thing.
Testing.
There's
Yeah.
another group of pre-diabetes, which is very relevant for India. If you want, we can talk about it later.
Okay. So, one question, I'll also take this. This is not directly related to the guideline itself, but I have come across some studies, for instance, which say that the reference range for vitamin D that we currently use is also debatable in Indian
Yes.
context. We need to
Yes.
have our own reference range. I would like you to please share your perspective on this as well.
So the reference range for vitamin D is debatable, period. It is not specific to India. That is, people are making that up. Is your cholesterol range different? Is your diabetes range different? No, it isn't. Certain things are good for health, so they are good for health. But the fact is that overall, the reference range is hugely debated, which is why these guidelines stayed out of that area totally. Earlier
Mm-hmm.
guidelines have discussed. So I can summarize in two lines for you a very acceptable reference range at the moment. Anything above 20 nanograms per ml of vitamin D, 25 hydroxy D, is normal or good for bones, good for outcomes. Don't have to target levels of 30, 40,
30.
50, which people are trying to do, which is wrong. And
Mm-hmm.
people with 27 nanograms would come to us and say, "Oh my God, my D is so low. I'm dying of D deficiency." So anything above 20 is normal. 20 nanograms, perfectly fine. There may be some specific situations where you may want higher levels. That's a doctor's call. Number one. Number two, anything below 10, and some people say 12 nanograms, is deficient and clearly deficient. So you can't say that a whole school has levels of 5, 6, 7 nanograms per ml, which we find sometimes in Delhi schools, and that's okay. That's not okay. It's between 10 and 20 where the confusion lies. So we would say that between 10 and 20, we would like people to be at 20 or above. Below 10 or below 12, maybe you should use. We should certainly try to supplement people with D level, with the vitamin D. Now, one
Yeah.
important point that is again relevant for the reference ranges, that all the studies that have been used in this American guideline, it's an American guideline, right? They baseline D levels have been above 20. So if your baseline 25 hydroxy D is above 20 nanograms, how do you expect a real benefit from using too much vitamin D?
Yeah. Absolutely.
That's the
Yes.
confusion. Wherever studies have shown in nursing home residents in the West and others that the D levels were low to start off, their benefits were clearly evident in Europe also. So I think this is important, that baseline D levels matter. However, one good formula that we have been recommending for a long time is don't even measure it unless you have a symptom and you come to the doctor and there's a reason to measure, right? Otherwise, just use 1,000 to 2,000 units daily, particularly vulnerable groups, and you'll be pretty safe. But there, if you're doing a study or in Indian environments where you're looking at, we sometimes get really low levels, then you may want to measure vitamin D level, and anything below 10 or 12 nanograms should be regarded as deficient, and above 20, no need to do anything.
So, one highlight of this guideline is also the use of vitamin D supplementation for pre diabetics. Now, we have a huge burden of pre diabetics in India. What do you think is the message there for Indian pre diabetics?
I think the message is important. Uh, there have been studies on vitamin D and cardiac outcomes, vitamin D and cancer outcomes, and some very elegant studies on vitamin D and development of diabetes. So while the
Right.
effect was modest, it wasn't a very profound effect. But the fact is, the studies have shown that when in people with pre-diabetes we supplement them with vitamin D, their conversion to diabetes becomes a little less, a little slower, which for India is highly relevant because the fact is that there have been some Indian studies on this also some years
Mhm.
ago from that. So the important thing message here is that we are actually talking of large groups of people who should be having vitamin D because India has 135 million pre-diabetes, right? So we are
Absolutely. This is a
talking
huge
of
number.
giving D to all our kids. We are talking of giving D in pregnancy or pregnant women. And we are talking of giving D to our pre-diabetics, which itself is more than 13 crores of people. So actually low dose D supplementation becomes very important. The final message here, will we be giving vitamin D to all these people? No. The answer is only those that reach a particular segment, of healthcare will probably get that. The answer is widespread fortification of milk. These
Got it.
countries, why is America less deficient than India despite being at a higher latitude? Is because there is fortification. So India has initiated vitamin D fortification of milk and edible oil, but it's not mandatory yet. A and
Mhm.
B, it's not at levels that will really make a big difference. It will make a minor difference. So that is being worked out by the FSSAI. So fortification is of essence. It's of great importance for a country like India, which has such low baseline levels.
So you mentioned fortification. Now adults, maybe 18 to 75 age group doesn't really need supplementation. Just I'm just curious. If we, for I as a healthy adult, for instance, if I consume milk and I get vitamin D supplementation in a way, won't, because vitamin D is also capable of creating or causing some sort of toxicity in people who don't really need it, and they could be overuse. So is that
That's
a
a
possibility
very
there?
good. Yeah. So yeah. So
Yeah,
that's a
please.
very important and logical question. The amounts that are added in fortification, or even the kind of amounts we're talking about, 1,000 to 2,000 units, anybody can take. Anybody. Even if you have
Okay.
30 nanogram level, even if you have 40 nanogram level, you can take those levels without risk.
It's
So
safe.
there is
It's
a
that
huge
much
safety window.
vitamin D is safe.
There is
Okay.
a huge safety window. We have a huge gap. There's no way you're going to get to toxic range unless there is a technical error in fortification, or 100 times more is added, or someone takes
Mhm.
some things by mistake. So I think this is fortification is a very very important tool for countries like India, and they already started on that path. So that's fantastic. But we need to push it, and we need to spread it, and we need to also increase the amount, and FSSAI is probably considering that also, to really get maximum benefit. I'll make one important point. I think you're running out of time, if I can see the time. One important point, and that is that
Please go
the
ahead.
only major difference for us would be that 50 to 75 age group that has been excluded in the guidelines in the US is a group that we will not exclude here. We will certainly see, we see a lot of bone disease in 50 to 75 age group. We also have a life expectancy of 73 to 74. So where are
Absolutely.
we talking about? So for us, that 50 to 75 age group is also important for using low doses of vitamin D. So
Okay.
instead of going to just 70, just 75, we should probably consider lowering that age. And the 50 to 75 group, which the American Society has said is not, doesn't really require. I think in our environment, given our longevity, lifespan, our D levels, and our diabetes, we are important. That's an important group. So that's the other difference.
So a key message that from what I understood by your explanations is that people generally don't need vitamin D screening. But can you please clearly spell out, is there still a subset of people who would still need vitamin D screening? If yes, what exactly is that group?
So that's not vitamin D screening then. That is case based, approach. So people who have any bony issues, bony aches and pains, muscle pains, unexplained fatigue, and muscle tiredness kind of thing. Yes, they do. Those who have other conditions, absorption issues, GI issues, who have chronic diarrheas, they will require. Those who are on drugs like anti-epileptic drugs, even anti-tubercular drugs, they may also require. So there's a large bunch of people who will require D levels. But going
Okay.
out and testing everyone in the population is not required at all.
Is not required. That's the wrap then. Thank you so much, sir. It was wonderful talking to you. Thank you so much, sir.